Hi there, I'm Dr. Jim, and today I want to talk about something CBD, very near and dear to me and my research and my writing. And I try to look at a lot of different physical health benefits of CBD, as well as mental and emotional, which I'm going to talk about today, as well as neurological and other types of benefits. But today I want to talk to you about CBD and panic attacks because it appears that a lot of people do have panic attacks and they're very difficult to deal with because you feel like you're out of control. So, gaining control when you feel that you're out of control is tough. And I do understand that. I know individuals who have panic attacks, and I have some friends that I've helped with panic attacks as well. So I want to share a recent article that I wrote entitled CBD and Panic Attacks. You could find it online, but I thought a video on this topic sounds pretty good as well. So a fairly common anxiety disorder, because that's what panic disorder is. It's an anxiety disorder. It's out of the DSM-5. But this disorder is characterized by a sudden episode, and sometimes it's out of nowhere, of intense fear that is associated with a variety of physiological reactions. The body starts to react, the brain and the gut and everything else they all start to react. And in doing so, we see things like a rapid heartbeat, sweating, and shortness of breath together, losing control, feeling like you're going to pass out. These symptoms are collectively called a panic attack. And annually, we believe that around 11% of the entire population in the United States experience a panic attack. While prescription medications, can be effective, anti-anxiety medications, the antidepressants, they might reduce the frequency and the intensity of the panic attack. They generally do have some side effects that can be short-term, a couple weeks, generally 14 to 21 days, and then they go away for the most part. Other side effects might be long-term, and some individuals try these medications and they just don't like them at all because of the side effects, so they just stop taking them. Well, now you're getting no benefit whatsoever. So a natural remedy, and that's where I'm going with this, that might be used as an adjunct, which means take it with prescription medications, or as a standalone, which means take your CBD all by itself, is indeed CBD. So this short video, the short article that I wrote, is going to explain why. So CBD for panic attacks, gotcha. Why? How? Let's talk about that. Well, in order to understand how CBD works, we have to understand anxiety disorders. Panic disorder is one type of disorder listed in the DSM-5 along with others. Social anxiety disorder, which is actually called or known as a social phobia. Agoraphobia, generalized anxiety disorder, and others. All of these are categorized as neuropsychiatric disorders, meaning that neuropsychiatric, there's a neurological, physiological component associated with the emotion and the thought and behavioral outcomes, like panic. Each disorder is characterized by things like excessive fear, restlessness, worry, and emotional discomfort. Let's go a little deeper here. The neurobiology of anxiety. What am I talking about? At the neurobiological level, alterations are occurring in the limbic system, which is associated with what? Emotion, behavior, long-term memory. They may be imbalanced or altered for some reason. When I say emotion, behavior, and long-term memory, what disorder pops into your head, which used to be considered an anxiety disorder listed in the anxiety chapter of the DSM, but now has its own chapter, its own section? What is that disorder? If you said PTSD, post-traumatic stress disorder, you would be 100% right. So, the amygdala, besides, we're talking limbic system, the amygdala specifically, which assesses, that part of the brain assesses the emotional significance of factors, of things in our environment, and definitely within our immediate environment. This can also be involved with anxiety and panic because we're assessing and we're looking for threats. Neurotransmitter imbalances beyond the limbic system and the amygdala. Neurotransmitter imbalances, particularly in serotonin and norepinephrine, may also be implicated in the neurobiology of anxiety disorders, including panic disorder and panic attacks. Okay, here's some symptoms, and then we're going to get into the how and why. Okay, common symptoms. The emotional symptoms are a feeling of losing control, or the thoughts that I'm going to die. Experiencing a sense of impending doom. Something really bad is about to happen. Don't know why, don't know how, I just feel that way. Or feeling unreal. This dissociative feeling, or detached from reality. Here are those are emotional symptoms. Here are the physiological, which makes panic a neurologically based condition, or a neuropsychiatric condition. Excessive sweating, racing heart, breathing quickly, chills, feeling cold, or on the flip side of that, hot flashes, okay? A tight feeling in the chest, nauseousness, gastrointestinal issues, headache, numbness or tingling, dizziness, or feeling faint. So an individual can experience 1, 2, 3, or more of those effects. Okay, the symptoms, the physical symptoms. Now, let's talk about the brain areas that respond to CBD, and this is going to bring all of this together. Research indicates that CBD may work on reducing symptoms of anxiety and panic through its interaction with various sites of the brain. For instance, it may work biochemically in the amygdala to reduce subjective anxiety and fear. Subjective means that's going to hurt me. Someone's going to hurt me. Something terrible is about to happen. Studies have shown similar results associated with changes in the basal ganglia, specifically the nucleus accumbens, the striatum, and the substantia nigra. In the cortex, in the cingulate, the insular, prefrontal, and temporal lobes, the hypothalamus, and the hippocampus. Okay? Brain parts, neurology, molecules. That's how this is happening. My final thoughts. Anxiety is the most commonly diagnosed psychiatric condition in the United States, and among the few anxiety disorders listed in the DSM-5, of them, panic disorder may be one of the most fearful and uncomfortable conditions among all of them. So while there are pharmacological, lifestyle methods that can help to manage symptoms, many people are turning to CBD for help. And I can tell you from the research and from talking to people, both anecdotally and clinically, we've discovered, and many researchers have, that CBD might help to reduce both the physical and emotional symptoms of panic disorder, panic attacks, and other anxiety disorders, as well as help to enhance the person's quality of life. There you have it. I'm Dr. Jim, another CBD topic. Keep coming back for more because I'm constantly researching and I have a lot to share with you. Thank you for watching the video, and I'd like to show you my new book, Living Longer and Stronger with CBD. It took me about a year and a half to write as I scanned hundreds of articles in prestigious journals, peer-reviewed medical studies, examining the effects of CBD for various physical conditions, emotional and mental issues, and neurodegenerative conditions. And I condensed all of those findings into one book. I believe that there's something in here for everyone. So if you're interested, follow the link to the book on Amazon. Thank you so much.